Hi, my name is Toni Crossan. I'm a master's student at Texas State University in San Marcos, Texas, and today I'm going to be telling you about how we evaluated antibiotic resistance misconceptions in undergraduate pre-nursing students. Our main problem is that although pre-nursing students in Texas and many other states are required to take an introductory microbiology course in order to become familiar with the transmission of microbes and disease, as well as the use of aseptic technique, their retention of this information is not good, and new and established nurses are ill prepared for answering patients' questions about infection control and the responsible use of antibiotics. Misconceptions about antibiotics and resistance are not just held by pre-nursing students, but even by advanced biology students and established medical professionals. These misconceptions are rarely caught by course assessments, so students are able to carry these into their professional experience, and these misconceptions can alter their understanding of pertinent concepts in microbiology and healthcare. Our purpose was to identify misconceptions held by a group of undergraduate pre-nursing students before and after introduction in antibiotic use in an introductory microbiology lab course. Students in lab were able to perform Kirby-Bauer assays in which they tested the efficacy of several antibiotics against different bacterial species. Our research question was, what misconceptions do undergraduate pre-nursing students have about antibiotic resistance and antibiotic stewardship? We had 33 pre-nursing students participate who were taking an introductory microbiology teaching laboratory that concerned the use of antibiotics. Before and after lab, students were asked to complete an electronic antibiotic use questionnaire based on competencies described by Courtenay et al. In a 2019 publication. Open-ended answers from students on the pre- and post-lab questionnaires were descriptively coded, and these codes were analyzed for frequency. You can see these codes, rationales, and frequencies in the supplemental rationale tables document. Answers to multiple choice and Likert-style questions on the pre- and post-lab questionnaires were also compared. Antibiotic use electronic questionnaire, which I designed based on those competencies laid out by Courtenay et al. They had 4 domains in their paper. Domain 1 concerned infection prevention and control, and we created 3 questions based on the concepts in that domain. Domain 2 concerns antimicrobials and antimicrobial resistance. We had 3 questions based on those competencies. 2 questions were based on Domain 3, the diagnosis of infection and the use of antibiotics. And 3 questions were based on Domain 4, antimicrobial prescribing practice. The text of this questionnaire may be found in the supplemental documents. When we measured percent correctness on student responses to each multiple choice question, we noticed a few patterns. Students generally performed significantly better on the questionnaire after lab than before lab, with a p-value of 0.038. This was most noticeable on question 4, which asked, is antibiotic resistance an example of evolution? This was the only question on which the post-lab responses reached a 100% correctness rate. Correctness tended to decrease on questions which addressed antibiotic stewardship and increased on those about infection control and resistance. Included a set of Likert-type questions to gauge student perceptions of their knowledge about 3 key topics. We asked how confident students felt in their understanding of how antibiotic resistance arises, the appropriate use of antibiotics in healthcare, and efforts to slow or stop the occurrence of antibiotic resistance. Confidence was moderate at best. Most students said they felt they understood these topics adequately. One student maintained that they still did not understand this after the lab activity, and only a few students said they felt they knew a great deal about this topic and could explain it well to others. 3 common misconceptions in pre-lab responses to the electronic questionnaire included that bacteria actively mutate on purpose in order to gain antibiotic resistance, that the human body becomes resistant to antibiotics, not the bacteria within the human body, and that mutations in bacteria are triggered by the presence of an antibiotic. Three misconceptions that were reserved in post-lab responses to the questionnaire were again that bacteria actively mutate on purpose in order to gain antibiotic resistance, that feeling better means a patient does not need to finish their antibiotic prescription as given by a doctor, and that bacteria can work together and communicate in order to create mutations that can confer resistance. The only questions on which students perform poorly, which I defined as less than 50% correctness before and after lab, were questions 8, which asked when a bacterial infection is suspected, what is a prescriber's ideal course of action? And 10, should a patient take the same antibiotic more than once? Performance got worse in post lab responses than they were in pre lab responses. These were the only two questions that had that pattern. A new misconception entirely appeared in post-lab responses to question 5. How do mutations, which can lead to antibiotic resistance, happen in bacteria? Students alleged that bacteria could use quorum sensing and other cell-to-cell communication techniques to drive mutation. I believe this may be as a result of their instruction in the week prior to the week they learned about antibiotics, in which they learned about biofilms and cell-to-cell communication, and students may have conflated the two topics. Overall, we learned that students definitely need further instruction in antibiotic stewardship, especially with regards to their future role as nurses in patient education and care. We believe that critical thinking and communication are important skills that should accompany this instruction so that students can learn not just the topics, but how to use this information in the workplace. Instruction in antibiotic resistance and stewardship should include imaginative activities that help students apply their knowledge to real life situations before they find themselves in these situations. Generation Z students, which made up the entirety of the sample in the study, that's students ages 18 to 21, especially require further education in interpersonal and communication skills to improve their ability to educate patients about topics like antibiotic use to prevent the rise of resistance. Thank you very much for your time.